Hi, my name is Dr. Katarzyna Shaffie. I will be talking today about dental implant aftercare. If you're watching this video, it means that you're coming to the conclusions probably of having dental implants, or maybe you had them done recently, so please follow me. To assure successful implant treatment, we need to start with preparations. So please do not plan your treatment on the day of your wedding, on the day of video shooting. So for me, it's not a day for the surgery. Please be mindful that this procedure will cause some swelling, pain, discomfort. If there is a big day, wedding, or you're traveling abroad, you should give yourself at least 2 weeks to recover fully. Also, it is very important to address medical history. If there is any uncontrolled disease, diabetes, osteoporosis, high blood pressure, also infections in your mouth, you need to prepare yourself, so it needs to be stabilized. Any disease in the mouth or any uncontrolled sugar levels have to be stabilized before you go for your dental procedure, any surgical procedure really. So here is what you should or should not do after your implant surgery. I know it might be very interesting how the surgical procedure looks like, and you might be tempted to check what was done. Try, however, not to pull your lip and then in front of the mirror check how it looks like. Try also avoid exploring the area with your tongue, because tongue is a muscle and you will apply lots of pressure. So pulling the lips or exploring the area with your tongue might cause problems. Also, if you use your hands, you might introduce bacteria to the area where we want the body to heal. On the day of the surgery, you deserve a good rest. Try not to plan any exercises, so try not to go to the gym. It is best to go home and have a restful sleep. So we recommend to put the pillow and then have your head higher up, as it will help with controlling the bleeding. And it is normal that after surgery you might have a little bit more bleeding. It is normal that it lasts till end of the day. Some of you might be thinking, shall I brush my teeth? Shall I not on the day after the surgery? So please do carry on with the oral hygiene the same as you used to, but try to avoid the surgical side. So the toothbrush shouldn't really dig into the surgical side. So please do brush your teeth, please do clean your tongue, but avoid brushing the area where you have lots of stitches. You will be also given a mouthwash. Try not to use it on the day one. We recommend to start using it following day. The mouthwash and excessive rinsing might cause that you lose the blood clot, and the blood clot is closing the surgical site, and based on the blood clot the body heals. So this is very important, not to brush heavily in the area and not to use the mouthwash on the day one. So please do your mouthwash on day 2, and please do use it twice a day, morning and evening. You might be given antiseptic mouthwash called Corsodel. This contains a chemical, chlorhexidine. It is antibacterial mouthwash, so it kills good and bad germs. For this reason we say use it for 5, maximum 10 days. There is also another reason, because if you use it prolonged time, it will stain your teeth. It might also change the taste in your mouth. So this is not a mouthwash that you can use regularly. You will be given written instruction from us, and you will find a paragraph stating do not smoke, do not drink alcohol. And you might be asking why. So alcohol disturbs antibiotics, and it is excessive, obviously, toxic load on the liver. So liver is the organ which metabolizes the antibiotics. Some antibiotics are harmful if you drink alcohol with them. So it is the best practice not to drink alcohol. Also, we say do not smoke. And there are few reasons behind it. Reason number 1, smoking. 1 cigarette, I wonder if you know, takes 25 milligrams of vitamin C from your body. So vitamin C is very important antioxidant for body to heal, to produce collagen, also to fight bacteria infection. So you need lots of vitamin C. Reason number 2, smoking decreases blood circulation in the area. So based on good blood supply, the wound will heal very well. If I decrease circulation, the wound won't heal very well. So that's the next reason why we should not smoke after the surgery. The study also and science behind states that there is 25% increased risk of implant failure if you smoke. So very often on our initial consultation, we advising patients, please try to quit smoking if you smoke. So let's talk about pain management now. It is normal that after numbness wears off, you will experience some discomfort. You should be able to control this pain and discomfort with painkillers that you were given on the day. Normally this is a paracetamol and we recommend to use it from 4 to 6 hours. You should not exceed the dose because it might be dangerous, so please refer to written instruction that will be given to you on the day. It is normal that you will have this discomfort from 48 to 72 hours. Any uncontrolled, hard to manage pain or uncontrolled bleeding needs to be reported immediately to surgery. So please do monitor carefully the situation. The pain should start subsiding on day 2 and 3. However, the swelling normally comes on day 3. Swelling is common and it is normal that the peak is on day 2 or 3. So don't be surprised that if your pain subsides on day 2 or 3 and suddenly you come up with the swelling on your face. The swelling might be under your eye, on the cheek and also on around the lower face. It is normal and try not to panic. How can you help with the swelling? So it is very important to cool down the area, and the study and science shows that if you cool down the area within 36 hours, you will have much less swelling on day 3. For this reason, you will be given an ice pack straight after your surgery, and please use it near the area. So if you had the lower implants, you need to put the ice pack around the lower jaw. If you had implants in the upper jaw, try to put the ice pack near the area. When you get back home, our ice pack won't be efficient anymore because it will become warm. So please use whatever you have in your freezer. You can use ice cubes, you can use frozen peas. So try to apply it for around 20 minutes, but not directly on your skin. Use the tissue paper and wrap the frozen peas and then place on your skin. You need to have these intervals because you don't want to give yourself a frostbite on the skin. So 20 minutes on and off within the first day will greatly help you reduce the swelling on day 3. So next question is, shall I eat after my surgery or shall I refrain from eating? So my advice would be try not to eat till you feel back your mouth. So you will be very numb after the surgery because we give you enough local anesthetics to control the pain, but also after we are finished, you're gonna still be numb. So hopefully you get back home pain-free, but after 2-3 hours, you will start feeling your mouth back. This would be the time to take your painkillers, and also you could start eating something softer and not very hot. So my advice is to have soup, but not very hot. Softer foods like omelette, pasta, rice, fish. But please remember not to have hot tea and coffee on the day because heat will stimulate bleeding and then it might cause you a problem. If there is any unexpected and uncontrolled bleeding, you need to contact the surgery. So also you can try to control it yourself with the gauze that is given to you in the goodie bags from us. If this happens, you need to wash your hands and then with the clean hands place a pack in your mouth and try to bite on it. The bleeding should stop. And it is normal that you might be bleeding till end of the day. For this reason, we're saying avoid hot foods. In regards to eating, please chew on the other side. So if you had surgery on the right, try to chew on the left. Also, you might find that preparing foods day before the procedure will be helpful because you don't want to really cook on the day. Thank you so much for your attention. I hope you found these videos useful. Please don't forget to come to your follow-up appointments because it allows us to monitor your healing process, and it's important to come because if there is a problem, we will assist you with it. And also it is very important to visit hygienists regularly. So please do come every 6 months. Thank you.